Well, good afternoon, everyone, and we'd like to welcome you today to the Flint Community Webinar on Coronavirus. Yes, it is July 1st, and this has been 120 weeks of Flint community leaders providing you a local context to this global pandemic. It is really interesting to see that after all these weeks, we're still talking about this as a very important issue. This webinar today is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. I'm excited today to be your moderator, Yvonne Lewis, and I've had an opportunity to be a part of many of these initiatives as the founding director of the National Center for African American Health Consciousness, director of outreach for the Genesee Health Plan, co-directing the Flint Community Healthy Flint Research Coordinating Center, and working with the Flint Center for Health Equity Solutions. This is a combination of all of our partners, which we will talk to you about in a moment, coming together to work intentionally to bring good information to you, credible information to you, our community. We have some amazing topics that we want to share with you today. Topics being COVID and the public health workforce. We've talked about how this affected others, but we're going to look at the public health workforce today. We're going to talk about trauma and post-traumatic stress disorder. We're going to get an update from the city of Flint on some things that are happening, as well as an update from the health department. And you're going to also hear some really interesting data updates today that I think will be relevant to really looking at a local context for what we're seeing across this community and across this nation. We are so thankful for all of the partners who've joined us for these 120 weeks. Today, some of the partners are on the phone to answer, on the phone. They are available today to answer questions for you as we're going through this webinar. So we're happy to have representatives from Hurley Medical Center, from Hamilton Community Health Network, from Genesee Health Systems, the University of Michigan Flint, University of Michigan Ann Arbor, Genesee Health System, I think I mentioned that before. Genesee Health Plan is here to help answer questions for you today as well. And we're looking forward to Genesee County Health Department also participating. We have representatives for these 120 weeks bringing you credible information. So we hope that this information will help you do better about engaging and connecting with people in the community so we can make our own informed decisions to ensure that we're doing the best for our community. I want to say today, as July 1st, we're also looking at a national activity. It is National Minority Health Month, focusing in on mental health awareness. And so it's really relevant that we're going to talk about some mental health issues even today. And so as we move forward, I want to invite our roundtable. Every week we try to bring to you some real information that will be credible and helpful to you. And so today's roundtable, we have Dr. Pam Hacker, Dr. Lawrence Reynolds, and Dr. Susan Wolford. Now we're going to hear from Lisa Bruder, who is a manager of education at the Genesee Health System, in a little bit to talk about these mental health issues. But I want to invite first our roundtable, Dr. Hacker, Dr. Reynolds, and Dr. Wolford. If you join me, please. I'm going to start with Dr. Hacker because we're talking about the public health workforce and what's happening in the public health workforce. You pointed out some things to me a few days ago about some of the general information about what's going on. So just help us to understand public health and what's happening in that workforce.
Ooh, that's a big question regarding which piece of it.
When we look at how our public health workforce has been also impacted, and you've got some information that you want to share with us as well.
Correct. So the public health workforce has been impacted probably significantly more than is commonly thought of. I think we all think of, when we think healthcare workers, we think in the hospital, people who are the front line in the full hazmat suits responding to inpatient, very ill patients. But there's been several studies that have gone out in the past probably 9 months, but they're keep coming, that the public health workforce is actually as equally affected, if not more so affected, by the COVID response in the past 2.5 years now than the frontline workers in the hospitals. And one of the reasons that is cited is that the hospital has more of the ebbs and flows, but as the communities are in the sort of recovery, building up again phase, the public health workforce is then getting the additional information to restart and revamp. So it has not let up at all. I recently attended the Michigan Public Health Premier Conference in Grand Rapids, and there was 4 keynote speakers. All 4 were speaking about the public health workforce and the impacts it has had on it. In terms of like actual numbers as well, people are leaving. We have seen great reductions in our workforce. So just as this 2.5 years of unending response has gone on, people are now looking at other options for their services. And so we have really been harmed by it. Not sure
So
what I wanted to talk about.
So you had some information you want to share with us on some odds ratios, and can you explain a little bit
so
about
that's not the public health workforce. Did you want to see that? Okay, let's go to that then. Okay, and while I study at Dr. Wolford's feet, I just have not even come near to presenting things as well as she does. However, I did want to talk about how you can look at some of the studies that are coming out, because there are so many studies coming out on different aspects, things that are smaller, something as specific as like kidney disease affected by COVID, things that you need a larger time or number of people in, and you'll be seeing these things. So I wanted to go over, even for those who are very familiar with something called odds ratio, I did want to just touch base on it for everyone, and also for the people who don't want to really know exactly all the statistics, but they do want to be able to use these information to spread the information to the community. It's actually a pretty complicated, but when you look at what does it mean at the end, it's very helpful for picking out one number. So odds ratios, let's look at these 6 dice. We want to make sure, just like there was isolation and quarantine, people had to kind of learn the difference between those 2 things. Probability and odds are actually different. So the probability of rolling a 6 when you have these dice is or when you have 1 dice, the odds of probability of rolling a 6 is 1 out of 6. So it's one side that has the 6 out of the 6 different rolls. But the odds is actually, I think, very much less intuitive. And if you think about the fact that you want to see what are the odds that you get a 6 compared to the odds you don't get a 6, it's the ratio. It's 1 chance of getting the 6 compared to the 5 chances of not. So the next one. So this is used then when you take these odds, which is a simple 1 to 5 kind of thing, and then you compare 2 groups of the odds. Remember, like your math, it's 1 over 5, and then you're comparing it, so you're dividing it by a different odds ratio. Let's do 1 out of 5 again. So then you flip the numbers and you compare it, and it comes up with something, and that is actually the odds ratio, which you will see all of the time in studies. And that's what I wanted to just kind of go over really quickly, so you can look at this part that's on the right in the bolded area. That's what you want to be able to focus in on and know what it really means. So the odds ratio compares studies that look at a certain outcome. And so the example I'm going to use in just a moment will be severe COVID-19 in 2 groups, when the 2 groups have something different about them. And it can be used to see if such difference, we're going to do weight, is associated with a certain outcome, which would be more severe disease or death. Then the odds ratio is comparing the 2 odds from the group of people who are overweight and unvaccinated, or who are normal weight and unvaccinated. They're going to be flipping those numbers that you get in the actual data from the study and coming up with a simple number. So an odds ratio of 1 means there's no difference whether you are vaccinated or unvaccinated. There's no difference between whether you weigh more than you should or if you don't. If it's less than 1, and what you're looking at is the risk of having severe outcomes such as death, if you are overweight compared to if you're not overweight, then if it's 1, it means there's no difference. But if it's less than 1, then the thing that's being compared means it's less likely to have occurred. So we know with COVID that if you are overweight, you are more likely to die of COVID. But we want to know what happens if you're vaccinated, because when people are vaccinated, some vaccines don't work as well if you're overweight. And one of those vaccines is the flu vaccine. Still effective, but it's not as effective as if you are overweight. So they wondered about the COVID vaccine. Is that one of the things contributing to people dying more? And because when they got it, it didn't protect them as well. So if it's greater than 1, you look at the thing being compared, that makes the outcome more likely. So the next page. So this just was published yesterday, I believe. It's very, very new. And I wanted to put it in there because I being an overweight person myself, I thought it was very interesting. And so the COVID vaccine, and so now they're looking at the COVID vaccine in the unvaccinated or the vaccinated, and then they're holding constant underweight, normal weight, overweight, or obese to see if that vaccine is going to affect things. So they wanted to know if it protected against severe disease and death in people who are overweight or obese, and it was found to be very protective. So comparing with unvaccinated, the vaccinated people in each BMI group experienced significantly lower likelihood of COVID-related hospitalizations and deaths. So here's the odds ratio. That's what that OR is. And when it's 0.5, then it's significantly less than 1. So your risk is basically cut in half if you're vaccinated. And that's going down if you're underweight. And the reason that seems a little like strange is because if you're underweight, you're less likely actually to get it. But when you look at the normal weight, overweight, or obese, those odds ratio are all basically the same. So the vaccine is working equally effectively. The first numbers are hospitalizations. The vaccine is protecting people of any weight equally effectively. It is slightly more protective with obese or overweight people. And they wondered if that was because more people who are obese or overweight were actually getting the vaccine. But still, it is looking about the same. And so each one of these being less than ones that people who are vaccinated compared to those who are not are still incredibly protected by it. And I'm going to give you one caveat, and you're going to hate me now after making you listen to all that. And the caveat was that this is a large study from England, and they did it from December of 2020 through November 17th of 2021. So what happened November 15th of 2021? Omicron came out. And so this was a study of all the people who did not have Omicron because it hadn't come out yet. But still, Omicron, as we know, is generally less severe, but we don't expect it to be any different. So when the vaccine is working with Omicron, it's probably going to be following the same thing. So I just want to make sure that people are realizing that this is something that still is important, but it's also very reassuring news that we are able to protect people no matter what their weight is.
Thank you, Dr. Hackett. And this really fits into something Dr. Reynolds says all the time. Dr. Reynolds says vaccination is the foundation. And so I want to ask Dr. Reynolds if he'd come now when we talk about a couple of things you've mentioned over time, Dr. Reynolds, when we're looking at research, but you're also talk to us a lot about why it's important to continue. And you mentioned earlier, you're trying to find more and more information, and it's a little bit hard so we can make the good decisions. So Dr. Reynolds.
Yes. I am not a public health person. I'm a primary care doctor and at best community health. And I say that so when you hear me say this, without public health, I would be flying blind because I would not know what's coming around the corner. I would not know how well things are working. And I really can't judge if we're making progress in our community without an adequately staffed and funded public health department. Then we get to the next issue. I can check the CDC just like anybody else. I can check with the Michigan Department of Health and Human Services. That tells me what will happen in this state based on what the CDC says. But then my job is not done until I check with our public health department to find out how it will be implemented in the county. And so you will hear me many times say, yes, I have heard about this development on the news, but I'm waiting for marching orders. And so we can talk about vaccines are coming, and that's good, But then we have to deal with vaccines are here. And once again, I have to turn to our public health department to figure out how we are going to connect and deploy people and vaccinations, and if and where I can support. So when I say I'm flying blind without our health department, believe me, we're just making wild speculations about we as people without health departments. We are speculating without the abundance of information that they have. And that comes to the topic you mentioned, updates. I just spent 30 minutes searching for an update because I wanted to see in writing, when should someone who had COVID-19 get a vaccination? And I searched until I finally found it in a footnote that was issued and re-updated yesterday or 2 days ago. Okay. And still, then I have to check to make sure my colleagues in public health have seen the same thing, and I didn't make a mistake and perhaps miss an update that came out a day later. So without them, I have no way of accurately verifying what's going on. I can make the best guess, but it helps to have confirmation. So the question is, how long do you wait to get a vaccine after having a COVID infection? 3 months. So don't assume because you have had the infection, you don't need vaccination, because vaccination will boost your protection against COVID-19.
That is actually a great example, because in public health, we often complain, particularly if we're by ourselves, about the whiplash we get, because it's like, here's that answer. So I would be curious where you saw that footnote, because now they've actually been saying for quite a while. So if it is indeed back to 3 months, that would be shocking to me. But they've been saying for a while to do it as soon as you feel comfortable, but minimum of 10 days, so you're not infecting others. But you could get it now at day 11. And we know that the vaccines are not as effective against Omicron. And if you combine the natural immunity from having just had the infection plus the vaccine, that's actually by far the best. I'm not sure if you were able to see some of those articles and reports of people getting 2 different strains within 20 days of each other when they're not vaccinated. 20 days. So I would really actually urge people not to wait 3 months anymore.
Okay.
Sometimes you see things like that in footnotes or something else, but you have to look at where their source came from. And if their source wasn't the most up to date, then they may publish it, but it's already out of date. So thank you. I don't know. We didn't really plan that.
Well, that's one of the reasons why this is so important. And we talk about bringing a local context to the global pandemic, because we need to know. And it's important that we have credible information here, that we can talk about it and bring that information forward, because people are, all of us, we have a lot of questions. We're still concerned. And we really want to continue to encourage people, join the webinar, share information with others so we can get this credible information. I want to just jump to Dr. Woolford right quick, because there's something that's coming out for children. And you mentioned also one of her exciting topics, and that's obesity. But what do we need to think about right now when we hear that vaccines are now available for children? Keeping in mind what Dr. Reynolds said, we got to wait for the health department, but what's the general conversation?
Thank you so much, Yvonne. Yes, I really want to emphasize what Dr. Reynolds said, because I too had the same experience that he had, looking up that very same topic. So I think it's really important, as he says, to check and double check and then make sure we hear it from our health department as well. When we think about children, I would like to say that as a pediatrician, I would like really to wrap all children up in bubble wrap to keep them safe, But unfortunately, I know we can't do that. So on this 4th of July weekend, when some people will be celebrating, I would like to suggest just a couple things or 3 things to do to keep your kids safe. One, let's think about getting them vaccinated. Every child down to age, well, most children down to age 6 months of age can get vaccinated. And there is that you can choose, if there are the choices, you can get the Pfizer vaccine, which is 2 doses, 3 weeks apart, and then a 3rd dose 2 months after the second dose. And then there's the Moderna, which is just 2 doses, 4 weeks apart. The likelihood is that a 3rd dose will be needed, but for right now, it's just that. So we should definitely vaccinate the children. On this weekend, when people are celebrating, please be safe. Fireworks and children are a bad mixture. Professional shows are the better way to go. But if you are going to do them at home, please follow all of the legal guidelines and keep them far away from them and all of those protective things. And then as we discuss that issue of excess weight, these are the times when we often put on that excess weight. So try to have a healthy 4th of July weekend. Think about including fruits and vegetables and those sorts of things into the celebration as much as possible.
Thank you, Dr. Wolford. Thank you, Dr. Hacker, Dr. Reynolds, and Dr. Wolford. Great insights for the day. And I really want to say there are still a lot of questions out here, especially about, there are some people who have questions about vaccines. So we want to talk about that more specifically. Even after all this conversation, still questions as to whether or not we should get those vaccinations and what their concerns are. So we're going to have some additional questions come forward and we'll have you answer them for our listening audience. And so thank you for the roundtable discussion. One of the other things that's come up is about trauma. And I think all of this has affected us so deeply. And so we have Lisa Bruder here with us today from the Genesee Health Systems that's going to give us a segment on trauma. She's the manager of education. And please remember, as this conversation is going forward, put those questions in the queue and we'll be happy to answer them for you. Lisa, welcome.
Thank you so much. And thank you for having me. I'm glad to be here today. I am going to talk about trauma and stress and the way that can impact our body. We're also going to touch a little bit about self-care and our own responsibilities to manage that, and a little bit about Genesee Health System and how we can support you. I'm going to share my screen and I have a PowerPoint to share. All right, so we're going to talk about trauma and resilience. So to kick it off, we got to talk about what is trauma. And it's so interesting that what could be trauma for me might not be trauma for you. And we're each going to perceive our different human experiences in different ways. We have different founding life experiences that are going to shape that trauma. But what we do know is that trauma is typically going to cause an overwhelming sense of terror and a bit of helplessness. And so we have some young people that may be exposed to community violence that it's not producing that overwhelming sense of fear because they're very used to it. Whereas if someone else was in that situation, it would be very scary and intense. And so we let each individual person define trauma in a way that's meaningful for them and displays and helps people understand their personal experiences. We also have stress, and stress and trauma can be the same, but that's not always the case. And so when we think about stress, that's going to be that body's alarm system that says, oh, I feel uncomfortable. I'm anticipating something scary, or even something that's coming up, like this webinar. As we're preparing for things, presentations, we have a bit of stress. And stress in a small context can be kind of helpful. It keeps us on time. It helps us follow our morals and values. But we want to manage that stress and keep it in that livable, workable space. Once our body's stress alarm gets too high, that can be a detriment to our well-being and to our physical bodies. Then we have secondary traumatic stress. And as I sit in a room of lots of professionals who have over the last couple of years, likely just eat, sleep, and breathe, public health care, the wellness of our community, all of these things that I know all of these wonderful humans have been doing, we also have to think about how all of that impacts our body. And so secondary traumatic stress happens when we experience, hear about, or live alongside someone else having a traumatic experience. And the symptoms that we might feel mimic post-traumatic stress disorder. And so even though we might not be the ones who are experiencing family loss from COVID or any other potential possibility, our friends, our families, and our communities are. And that can cause secondary traumatic stress. Excuse me. Some other terms you might hear are compassion fatigue and vicarious trauma. And those are pretty similar to secondary traumatic stress. And words have kind of been shifted over time to remove the stigma from them. But burnout, that's one you want to watch out for. Burnout isn't something you can recover from in a day or a week or a month. It's that end of that secondary traumatic stress spectrum that is very unwell for your body and for your brain. Burnout isn't a bubble bath and go to work on Monday. Burnout is taking a substantial amount of time to reset your well-being. And we want to do lots of really great healthy things for our mind and body long before we get to that burnout. So if we're edging towards burnout, some things we want to watch for. Remember, once we know better, we do better. And so we have to watch all of these signs and symptoms and be responsible for our own recognition and changes. And so we might feel exhaustion, feeling cynicism. If you're looking at everything in a really negative light, and that's not your typical, if your first thought is, oh, I can't believe they're doing that, or oh, I don't like that, take an internal check of yourself. If that's not your normal, that could be you moving towards some burnout. If you're feeling useless, depressed, having negative feelings towards an activity or a group of people or even an idea. If you're feeling irritable, inability to focus, when we're in survival mode, it's hard to focus on all of these extra things. Our brain is stuck in that spot of surviving and making it through. And then not wanting to do things. We kind of pull back a bit. We start to isolate ourselves. And that cynicism can get into places of like, they're not good for me, or this isn't good for me, or I don't want to be around all these people. And so if you start to isolate yourself, that might be a good time to check in and make a plan. We often hear about trouble sleeping, having frequent headaches. Remember, all of that stress manifests in our body in a big way. So those somatic symptoms, your stomach hurting, having some irritable bowel syndromes, having those headaches, the stress and tension in your neck and shoulders. Your immune system can be weakened by stress. Frequent use of drugs and alcohol. We know that when we're stressed, people lean into things that help you feel better. You're seeking that escape. Eating too much or too little, high blood pressure, and of course, absenteeism. This affects our ability to be productive and meaningful in our professional spaces as well. So who is at risk? Helping professionals, to everyone on this call today, and a lot of people who are viewing it live on Facebook, highly empathetic individuals. Again, everyone on this call and people who are viewing it, you are the carers, the lovers of our community, and that makes you at risk. Prior traumatic experiences. It's been a wild, 10 years in our city. We have the Flint water crisis, we have COVID, lots of racial inequities, loss and grief. Those traumatic experiences can be complex and compounding. Frequent exposure to stress and trauma, being socially isolated and not understanding it, which is why I said, once we know better, we do better. And today we're going to know better. One thing really, really important to remember is that we are not doomed. Just because we're part of a community that has been through some really difficult things doesn't mean that we're doomed to negativity. We can build in protective factors and resiliency, each for us as individually and systemically for our entire community. And so that's knowing and understanding about stress, those risk factors, and how to take care of ourselves, and pledging to yourself to have daily self-care and mental wellness. We're going to talk about self-care in a second. And it's important to remember it's not the bubble bath once a month or that massage once a month. Self-care is an every single day requirement for your own wellness, and you get to choose what that looks like. So before we get into self-care, just some emotion. I'm going to break down the reactions for each part of our body so that you can recognize in yourself. So I want you to think about how you feel, maybe when you walk in the door from work, or as you're preparing for work on Sunday evening. If we're feeling irritable, like our emotions are more out of control than typical, feeling anxious and fear, anger, rage, and hostility, that detachment or shutting down, feeling bored, or feeling incompetent. Some cognitive reactions could be diminished concentration. Again, when we're in that survival mode, it's hard for our brain to focus on other things. We could feel confused, having some intrusive imagery about specific trauma or just in general. If you find your anxiety is popping into your brain in general, or in the way of images, that's not typical. That's a good indication that it's time to slow down and manage some internal wellness. Feeling self-doubt, worrying about other people's trauma. It is really easy, and I do this too. It's easy to focus on other people. If I could just help them and work on them, then I don't have to manage my own stuff, but it always comes to get us. And perfectionistic thinking. You know, when we start to feel not competent or not in a comfortable space, we want to hold on to what we know and what we do and what we're good at. And that can kind of get us stuck in some rigid thinking. Behavioral reactions, feeling impatient with others, particularly our families, sleep disturbances, nightmares, feeling that startle response. Well, if our body is on survival all the time, our brain is like, watch for it, survive, be careful, it's coming for you. And so your body's ready. And that startle response can creep upon you. Feeling hypervigilant, different negative coping skills. We talked about those. Losing things. Spiritually, lots of people will start to feel a loss of purpose, feeling meaningless, being angry at your higher power, questioning spiritual beliefs that were once really important to you, or feeling hopeless. Some interpersonal reactions, again, will be withdrawing or isolating, decreased interest in sex or intimacy, mistrust in other people. Of course, it impacts your parenting. When we're stressed, our little ones notice that, sense that, and can recognize it in us sometimes before we do. And we project our anger and our blame, and it's hard to tolerate other people's difficult behavior when we're internally not feeling well. So to cope, we intellectualize. We deny it, we avoid it, we minimize it. Maybe we over-identify it. We get anxious, and drugs and alcohol. So the benefit is that there is resiliency, which is our brain's ability to adapt. So if we think about resiliency on a scale, we have challenges and we have great things. And we want that scale to be balanced or to have more great things. So this allows us to push through hard things. Even in those challenges, we're saying, I got this, I can make it through. I am capable of hard things. You are not either born with resiliency or born without resiliency. Everyone can build it, and that will help us get through all the hard things. And we know that resiliency manifests in our body during times of adversity. So when we're struggling cognitively, we're able to reframe it and say, "Ooh, this is heavy, but I can do this. I am capable of hard things." Behaviorally, it helps us push through. We stay motivated to have that endurance to get through challenging times. We're more motivated, so we're not feeling those feelings of incompetence. Instead, we're like, I am capable of all the things. I'm strong. I did it before. I'm going to do it again. Your spiritual connection remains intact because you believe in that higher power. You lean into that power. That meaning is real for you. In the relational sense, we stay connected. We're able to say, I remember going through a hard time before, and I made it through with the help of my friends, family, and community, and I'm going to lean into them again. And emotionally, we're able to bounce back from those hard feelings. It's not depleting us. Take a deep breath, take care of yourself, and you're able to move forward. So resilient people are more likely to do well at school, at work. They're more likely to jump into a difficulty, take action, and handle it. They're more likely to ask for help and seek support. They know when to stop, when to rest, take a deep breath, take care of yourself. They're stronger, more independent self-starters. They're positive people who have respect for their peers and coworkers and relationships, and they have a sense of purpose and goals for their future. It is not a fixed state. We all reside on the same spectrum of mental health, and we move up and down on that spectrum depending on our level of resilience. And just like our mental wellness can move up and down, so can our resilience. And so when we're challenged with times like right now, where life is confusing and stressful, we do things to build in resilience, to lean into our community, to say, let's do this together. And so we have that balance. And this balance could be work and life, or it can be stress and resilience. And always making sure when we feel that stress creeping in, we say, this is my responsibility to take care of myself because I am worthy and meaningful, and this will help me, my family, and my community be well. So we want to maintain social engagement. That keeps us well. As humans, we're seeking connectivity. We're seeking people to witness our life and our human experience. And so it doesn't have to be hundreds of people, but finding your person to enjoy that connectivity with. Unplug, be face-to-face when you're able. And I know that's harder now than ever. Be part of a group or organization, volunteer somewhere that's meaningful for you, or just practice kindness and happiness. We talk about mindfulness all the time, and I'm going to send you some websites here in just a second, but mindfulness, it's meditation and it's great things that you can do once in a while, but mindfulness is also that ability to just slow yourself down and say, where am I in this moment in time? So if I'm multitasking at work and I have emails and my phone's ringing and people need things, taking 2 seconds and saying, I'm a 7. And when I'm done with this phone call, I'm going to take a minute to bring myself down. So at any given time, being able to gauge yourself and where you're on that scale so that you're aware when you start to get too high. Because when we get too high on that scale of feeling disconnected, uncomfortable, anxious, or fearful, we're not as functional. We're not able to be part of our family, soothe, connect, and feel well in that situation. So we want to eat well, move your body, drink water. We are houseplants. And I know when we start to feel stressed and depressed, we pull away from that. We want the sweet drinks, the coffee drinks, we want the fast food. But that's our body saying, I need nutrition, I need wellness. Just like if we hurt our knee, we rest and we eat good food to help it heal. When we hurt our emotional state, we need to rest, eat good, drink water to help our bodies heal as well. So we're going to manage stress, practice self-compassion. Again, you are worthy and you are worth this internal work. We're going to cultivate opportunities for personal growth. When we do well, we feel well. Make time for yourself in that quiet reflection, no less than 5 minutes a day, where you have no electronics, just time with you and yourself and your thoughts to reflect on what went well, what you want to work on, what feelings you had during that day that maybe you want to move forward on and take action on and changing them. And of course, finding time to play and have fun. In times of stress, we get hyper-focused on fixing things, managing things, supporting others. But we also want to take that time to remind our brain that life is fun and we're going to make it through this. So just for some resources, if you go to our website, which is genhs.org, there's some opportunities. That top link there, if you click on resources and training, we have lots of classes every single week. Mental health first aid, we do living work suicide prevention, question, persuade, refer suicide prevention. We have a trauma and resiliency course. These are all free to anyone. You can register online. The second website is our GHS Mindfulness. Talks about different resources that you can use, education, videos, things that are available to you. And that third one is a specific website specific to trauma-informed care and all the things I'm talking about today. There's lots of YouTube videos that I usually show in this presentation, and there's a copy of a presentation I did for this group at the beginning of the pandemic. So it's kind of an extended version of trauma and post-traumatic stress disorder. And my last slide is just talking about our behavioral health urgent care. Genesee Health System has made lots of changes over the last couple of years. We historically used to serve primarily a Medicaid population. Today, our services are available for anyone and everyone, regardless of mental health status, regardless of income, regardless of insurance. Our behavioral health urgent care is on 4th Avenue. It's still at that corner of Grand Traverse and 5th, right across from our main building. It is open 24/7 virtually and in person from 8:30 a.m. to 10:30 p.m. This is set up to help people manage big feelings. Even if you're just having a tough day, you can call, chat with us, come in, talk with us. But also for people who are avoiding jail and ER, recognizing that we are the mental health experts in the county. And when people are struggling with mental health crisis, we want them to land with us so we can care for them in a meaningful way. And so anyone that needs our support, particularly essential workers, people who have been stressed out through this last couple of years, this support is here for you too.
Thank you so much, Lisa. And I think all of us can find some value in what you shared today, particularly those of us who are caregivers and outreach workers and community health workers, social workers, and in the various places that we work. So I hope we'll took some good notes, and you surely can put some additional questions in the queue. Lisa will be here for the balance of the webinar to answer any questions that you might have. Thank you so much, Lisa, for a great presentation.
Yes, thank you.
You've given us some good ways to think about what we're going to hear next, because Alan from the University of Michigan State University is going to give us some tips, give us some insights actually on where we are in our county as it relates to what it looks like in the rest of the world. Alan.
Thank you, Yvonne. Thanks for having me. So we're going to start off and just talk about the last 5 weeks. Case counts are going down steadily. There was a slight increase in confirmed new cases, but when you take into account the lag and the probable cases, we're still seeing a steady decline. But the state of Michigan as a whole is starting to see, it's very small, relatively small, but we're starting to see more cases. So we've been sort of enjoying this steady decline for a number of weeks. It's still good to remember that this really isn't a seasonal virus, COVID. We would like it to be. We want to understand the last 2.5 years of patterns. And once everyone's outside, we're fine, but it really doesn't come down to that. The way people behave and the way the variants have evolved, we always have to keep our eye on if there's increases. So this last week, from last week to this week, confirmed cases have gone up slightly, as well as, the testing positivity rate, it's fluxing just slightly, going down. Next slide, please. So this last week, so I've taken the last 10 weeks, which I'm considering our current surge that we're in. We're hopefully on the tail end of that surge, but I took the last 10 weeks of COVID data and I broke them into these age brackets. So at the bottom, what we're looking at is age 0 to 17, 18 to 24, 25 to 39, 40 to 49, 50 to 59, 60 to 69, 70 to 79, 80 plus. And much like Dr. Hackert's the equation that she was talking about, we're basically taking a percentage, dividing it by a percentage. I took the percentage of these COVID cases by their age brackets, and I divided them by the percentages of those age brackets in our population, in Genesee County, in Flint, and in Genesee County when you exclude Flint. And so the closer to 1, that means they're even. So the population of 0 to 17, if it were 1, that means about 20% of COVID cases in that age group are also equal to 20% of that population as a total. So when you see these numbers that spike above 1, it means there's more COVID cases than there are of that population. And just managing to tease out trends with this, 18 to 24 all the way to about 50 to 59 tend to have a higher number. And if you think about those numbers, those ages, that's basically our workforce. So it makes some sense in that way, but it is good to arm ourselves with this knowledge about where on the age spectrum are COVID cases concentrating. And if it is our workforce, and not everyone can bow out of activities and everyone has to go to work and be, in the community, then their exposure is going to be higher. Another way is to sort of tease out geographically are, the 18 to 24 numbers in the city of Flint are much lower than their suburban counterparts. So what does that mean as far as our behavior? So it could be a work thing, but it could be a social behavior or what's happening from these last 10 weeks. And these are just ideas that I'm throwing out. And we're always open to getting feedback. If there's something specific that you want to see, we're doing this every week. So we're not running out of ideas, but we will take any ideas from the community as drivers for creativity. Next slide. So another thing that I want to do is we get so wrapped up in just looking at Genesee County sometimes, or we're just looking at those numbers every week. It is nice to zoom out, especially it's the summertime, 4th of July is coming up, as well as just everyday travels and family things come up, and you want to travel throughout the state of Michigan or other parts of our country or other parts of the world. It is just good to arm yourself with the knowledge of numbers. So if I'm going to a different side of the state, or I'm going up north, or I'm heading out west or to Florida or Louisiana, what are those numbers? And just arming yourself with the knowledge. It's a difference between taking a calculated risk versus an uncalculated risk. I believe we have those links that we can share. Throw in the chat here. And that's my piece for this week, but I'm open.
Thank you so much, Alan, because you put in a context. It's really important to put the local context on, but as you said, we're going to be traveling, many of us, and so it's important that we are able to make informed decisions based upon quality information. So again, we'll ask all of you that are in the webinar, please put those questions in, and if you need would like information in another form or additional information that may not have presented, this is an opportunity for you to help us make sure we're responding to the needs and the concerns and the information in a way that you can receive it. So thank you so much, Alan. We'll look forward to you coming back and joining us next week. And as we move forward to looking at, we've already talked about the health department being really critical to all of what we're doing. So we're going to ask Ashley if she would come and give us those quick updates from the health department, and we'll just go through this segment as well. Ashley, welcome today.
Hello, thank you. Thank you for having me. Always a pleasure to jump on and give you guys a brief update. I know we're running close on time, so I'll try to make it as quick as possible. As of today, I know that our website says 108,000 COVID cases in Genesee County. We are reporting 109,042. So our numbers are still going up, but we are being mindful of that. We have our whole EPI team monitoring it, and they are fantastic at their job and get us those numbers every day. Our statistics, our cases by sex and overall confirmed cases by race, you can see they don't vary too substantially, but it is something that we continue to report to the public so that everyone can make a conscious and safe decision for themselves moving forward when it comes to safe practices, vaccination. Are they at risk based on what they see, make their own perception. But when we continue to give them this information just to arm them with education. So we are still hosting vaccination clinics. I'll try not to jump around too much. We have given, as Genesee County Health Department and partners of the Genesee County Health Department, including Michigan United, Michigan National Guard, and with assistance from Latinx, we've given over 84,000 vaccinations just from Genesee County Health Department alone. That's just 84,000 doses. It does not break down to first or second or booster, first, second, third booster. So it's just something to keep in mind that our vaccination efforts are still ongoing. I am still monitoring our hospital data at this time. We do have 35 inpatients right now across all 3 hospital systems in Genesee County. One of them is a pediatric case that is a PICU case. All of these cases are monitored very, very closely on my end, just to make sure that we see how trends are shifting within hospital admissions. For the month of June, we're still wrapping up that data on our end. We're looking at just over 5 admissions a day on average. And our vaccination status for our hospital admissions are, our hospital COVID patients, we're looking at about 40% of them were fully vaccinated. That includes boosters for that definition, as well as, and then 60%, around 60% of them being either unvaccinated, partially vaccinated, or unknown. We do still have individuals who come in who may have an altered mental status, who do not have any information presented as far as vaccination status is concerned. I know there's been some confusion on what vaccination status unknown means. Typically, that's a category for individuals who are unable to provide that information. Hospitals seem to be running well right now. There's no complaints on their end. I am in communications with all 3, and we do our best with what we're given. And what I've said before, we just continue to move forward and help our community the best that we can, give them the resources they need to be successful with COVID. If you are admitted to a hospital, make sure we get them to the best health status they can be, so that they can leave that hospital with the best chance possible. So we still continue to promote vaccination, obviously, to help reduce severity of disease. We are offering vaccination for 5 months and up, as we have discussed earlier in this webinar. Age parameters. The health department is offering pediatric vaccinations at our 3 brick and mortar sites. So there are 3 consistent sites that includes Our Lady of Guadalupe Church on Coldwater, Central Church of the Nazarene on Bristol Road, and Shiloh Missionary Baptist Church on Saginaw Street. These 3 sites work on alternating schedules. Our vaccine clinic schedule for July is up. So we start with Our Lady of Guadalupe and Shiloh for this week. And then next week it's Central Church of the Nazarene, and then they continue to alternate. Times are listed there. Again, we are offering pediatric vaccinations and up, so 5 months and up at these clinics. If you have any questions or concerns about vaccination, you are welcome to go to our website at gchd.us. We try to put as much information out there as possible, just to make sure everyone can make an informed decision for themselves as well as their loved ones, including our littles. We got to keep our tiny humans up to date with vaccinations, not just COVID. So let's make sure we make some educated decisions. We still have our 3 testing sites, our HANU sites that are partnered with MDHHS. That's going to be our Word of Life Church, Bethel United Methodist, and Macedonia. These are specifically just testing sites. You cannot get a vaccination at these sites that has not been updated or changed at any way, shape, or form. So if you do need a COVID test, these 3 sites are available for you. They do both rapid antigen and PCR testing. And then we still have our 3 other clinic sites, our testing sites, I should say, are Walgreens, Hamilton, and Rite Aid at the specified locations. Those have not changed as well. All of this, again, can be found on our website, gchd.us, under our COVID-19 tab. If for some reason you present with any barriers to internet access or technology in general, if you do require assistance in any way, shape, or form, and you just don't have the means to go onto our website, by all means, please give our COVID-19 call center a call. It's 810-344-4800. We have English and Spanish capabilities at our call center. Please reach out to us and let us know if you need any help whatsoever. We'll be happy to help you, but we do ask that you keep this line open for those that actually need help and assistance getting the information that they need. If you are capable of going through the internet, going to our website and navigating through that safely, please do so. And I think that's it for me today.
Thank you so much, Ashley, just to keep
You're
us
welcome.
up to date on all the things that are going on with the health department. And I do know some community organizations are out and about, like you mentioned, Michigan United and others. So there will be some additional pop-ups that are going to be happening in the next couple of weeks. And we're also going to just be encouraging everyone. Let's make sure that our community knows that these opportunities are available and to do those things that we need to do, even in the face of not getting a vaccine. As you see, we have people who have not. Let's make sure we wash our hands, mask up, and do all those things that you tell us to do every week. So thank you. Thank you so much, Ashley, for that update. Want to go quickly to the city of Flint. Kiana is here with us today. Kiana is the communications director for the city of Flint. And you've got some updates for us today, Kiana. Welcome.
I do. Good afternoon, everybody. I hope you all are having a good Friday. I hope most of you are off work, but if you're not, I hope it's slow. Just a couple of announcements from the city of Flint. Wanted to let the community know that the receptacle at the back of the parking lot at City Hall there on 7th Street is temporarily unavailable because of the carnival. The maintenance team has decided to remove that. So right after the celebration on July 4th ends, they will move it back into that space so that we're able to drop off those recycled bottles at the city of Flint. So it's a temporary move. It'll be back just after the holiday. And just a reminder that the city of Flint is closed on Monday, July 4th, in observance of Independence Day, making sure that residents know that your trash pickup will be delayed by 1 day. So if you generally put your trash out on Tuesdays, they'll be around on Wednesday to pick it up. If you have any questions, you can reach out to Priority Health and they'll be able, Priority Management, and they'll be able to assist. And so I mentioned earlier that the carnival is happening here, and we are very, very, very excited about it. For the first time in the city of Flint, we are hosting the Flint Freshwater Festival here in part. And so on the back lawn, just outside my window here, I can see the carnival set up. It starts today at 3 p.m. and goes until 9. They shut down early today to accommodate their partnership with Communities First. So Communities First will be hosting their movie night on the lawn as well tonight. And the carnival will continue through the weekend and into Monday, and will close at 10 o'clock on Monday, July 4th. So there are a wealth of activities happening around the festival. The city is hosting the carnival here on the grounds, and the schedule is available on the city's social pages, or you can visit richkidsinc.org for more information.
Thank you so much, Kiana. We appreciate those updates. Did you have one? I see you got one more thing.
So I did. I just wanted to very quickly remind the community about the 4 Pillars mental health program. Mental health has been a theme for the webinar today, so I just wanted to throw that in. Grace Emmanuel Baptist Church, in addition to several other sites, are hosting mental health services throughout the week, and you can visit genhs.org to look for that information. The mobile mental health unit will be on site, and they have free resources available to support our community. And as has been mentioned, taking care of ourselves is really important. Taking care of our mental health is very important. And so please visit genhs.org for more information on where those sites are, so that we're able to get community out to get that help.
Thank you so much, Kiana. And you mentioned getting the community out to get that help. I just want to say to all of the partners on, and we can do a quick Hollywood Squares as I'm closing the webinar out today. All of these partners have been so instrumental in helping us get the word out. We as a collective community, putting a local context to this, we want to encourage you. Let's tell somebody else. This webinar is an opportunity for us to get this credible information. Our community health workers, we want you to stay on as soon as the webinar is over so you can apply for those community health worker credits, as well as our social workers to apply for those social work credits. In the next few days, in the next few weeks, we're going to be talking to our community about the importance of listening to our local credible voices. 120 weeks this has been happening, and so we could not do it if you were not helping us get this word out. So we want to ask you to continue to like us on Facebook, subscribe to our YouTube channel, Healthy Flint, and email us with any questions. I know we say that sometimes, and then people say, yeah, mail us in any questions, but we're saying we know you have questions. As was mentioned earlier, some are still a little bit concerned. There are areas in our community that people really haven't heard this information yet. It's important that we work together to get the word out. So like us on Facebook, subscribe to our YouTube channel, email us those questions if you have them at info@hfrcc.org. Give us a call at 810-835-2130 and join us next week. We encourage you, help us to get this word out to others. Join us next week for week 121. We want to answer your questions with credible, local, trusted voices. This is the Flint Community Webinar on Coronavirus for July 1st. Thank you for joining us, and we look forward to seeing you again next week.